Hey, Crispy Brown here, back again with another vlog coming to you live from the Show Me State. Got this little tree in the background tonight, get a little greenery in the action. Some ugly curtains over here, but not near as bad as the ones that are in my hotel room. So, took a break last week from vlogging. Had a good Labor Day weekend, hope everybody else did too. And tonight I am pleased to have my second guest, Mr. Karl Froelich. Karl I've been knowing about for several years. We've kind of ran in the same circle. He is also a pharmacy consultant. Had the pleasure of meeting him here about a couple months ago, and he's back on the same project now. So as I said, he is a pharmacy consultant, but lately he's been doing a lot of provider training, and so that's what I brought him on tonight to talk about. He owns his own company, which is called Zone Informatics. And Karl, where did you get the name Zone Informatics?
I actually got the name years ago. I went on vacation with my wife on a honeymoon. We went to Costa Rica, and that's where I learned about what a blue zone actually was. And in the 80s, a group of scientists had studied certain areas on the planet where people happened to live the longest and were the happiest. And so about 3 years ago, when I started up my own company, I was trying to figure out what type of name we should come up with, and I kept coming back to Blue Zone. And what these scientists did discover was that it really boils down to like three basic things. And it's not the areas in the earth that you'd normally expect, but basically it's healthy diet, no smoking, no drinking, or limited smoking and drinking, I should say. An intense family life together, where the elderly kind of like stay within your family for quite some time, and overall happiness. And so when I was thinking about the name of the company, I really wanted to come up with a few core principles that I could apply to healthcare informatics. And the first one is knowledge. You have to be a knowledgeable person or a subject matter expert in what someone's hiring you for their help. Secondly, it's all about the approach. In other words, when I go on a project, I always try to be upbeat and happy. And a lot of times these projects are very stressful on an organization because they've never really been forced to work together in this type of capacity. It's basically like constructing a building, you know. One application is like the plumber, another's like the electrician, and so forth. You have a project manager, and then people that normally have got together and gotten along, they start getting testy. Well, when we come into these situations, like I try to just like, you know, we have to deal with serious issues, but try to do so in a happy way and try to cheer somebody up and be
a positive
upbeat.
force, right?
Exactly.
Yeah,
so that's the approach. And lastly, it's be a teacher. You know, it's great to have all this knowledge and be able to do all this work for people, but when it comes down to it, they need to be able to stand on their own feet when you're all done. So not one of these persons that likes to hoard the knowledge to myself. I'll try to teach somebody as much as I know about whatever subject matter we're talking about.
I agree. Completely agree.
So those are the three core principles. And lastly, I just wanted a cool sounding name, to be quite honest.
I like the sound of the name. I like the principles as well.
I didn't realize that nobody knew what blue zones were, though. So it's not that of a common of a thing.
A Muse conference a couple years ago, and they actually had the guy that came up with the blue zones and did all the studies about it as a speaker. And so
is that right?
Yeah, I thought it was very interesting. And you know, you mentioned family in there, but I think another thing that he mentioned in the presentation was friendship. And you know, they often have lots of friends and family around, and I think they're even doing cities now to just help, you know, around this blue zone idea, and you know, opening up paths to where you can get exercise and that kind of stuff. He talked about that a little bit in the presentation too. But moving on, so give us a little bit about your background as far as consulting goes or informatics goes. And
sure. No, I've been in the business now for about 17 years or so. I started off...
old timer.
Yeah, I'm an old timer. I started off as an employee for MEDITECH. That's how I got into healthcare technology. Was there for about 4 years as a member of the pharmacy implementation group. And then we actually left the state of Rhode Island, where I was very close to MEDITECH, moved up to Maine. So I could no longer work there in that capacity. So first thing I did is I got right into consulting, and there I've been ever since.
Yeah, enjoy it?
I do enjoy it, yeah.
So lately there's been a lot of 6X projects, Expanse going on. Yeah. What do you like about Expanse? This project we're on now is Expanse, and you know, it's a question I like to ask people when I'm talking to them.
What I really like about Expanse is it's kind of really got MEDITECH up there to like a modern look and feel, like that website look to it. A lot of people are complaining this seems old-fashioned, even client-server, 6-1, but now once Expanse has come along, it's really streamlined things.
It's integration, right?
Absolutely.
Yeah.
So it's just got a nice look and feel. It works.
All the
got the
ordering
functionality.
centralized, right?
Centralized ordering, exactly. So you're not just clicking on a med tab, clicking on an order tab. Now it's just all there in front of you.
Yeah,
So
you can see everything, every
yeah,
option that's out there. Really.
they've really redone the screen. So I would say it's like the first real big jump to the next step there, where
Yeah, I
they've
would
really
agree with that.
redesigned things.
Yeah, definitely.
Yeah.
So you're back on this project to do provider training, and so what is the ideal situation for provider training? Like, do you prefer one-on-one training or big groups, or how do you feel about that?
I think a big group training is good initially, just to get the group together and kind of get them exposed as to what they're going to be working with. But ultimately, when you're dealing with computer systems, it's the hands-on where people really learn. So what I really think the most valuable part is one-on-one trainings.
Yeah,
I'm all for it.
I'd agree with that.
Hands-on.
I tend to learn best.
Have
that way
them
as well.
log on with their user, set up the PIN, everything, and then go from there, do your documentation and orders.
Yeah, good deal. And so part of that provider training is really building the documentation to support that training. And so when you're putting together this training documentation, what do you try to strive for? What do you think makes good documentation in that area?
I think the best thing to do is look at the materials that MEDITECH has on their website, try out a few things just so you're very comfortable with it and so forth, but don't use that per se as training material, because it's very generic. It's not the type of screens that are built out in your specific healthcare system. So once you've done that, I really like to build it from scratch. And I basically like to have a screenshot up front, a few arrows and bullet points. I try to keep it simple, but just like hit upon like the most important things, be thorough, and then come up with some nice, quick cheat sheets on how to do certain things where people get stuck.
Yeah, and one of the nice things about MEDITECH is that it's very customizable. So if you're using that stuff that's coming from their website, then it's really not what probably doesn't
It's
really
not-
look like what your site has out there.
Right, and
Yeah.
you may not be using this feature, you might be using another feature, so you really want to gear it towards how you've built the system and what you intend to implement.
Yep. And so a big part of when you're training providers, or a big part of the provider job is, their documentation piece and how they document in the chart. And so what do you tend to look for? What do you like to see when you go into a system? And really that documentation these days drives how the provider or the hospital gets paid, right? The clinic whoever's
Exactly.
getting that reimbursement. So what do you like to see? Do you have a preference, or do you have any thoughts?
As you're building your provider templates, I mean, the best rule is to keep it as simple as possible. I've had surgeons tell me, I can take out a gallbladder in 5 minutes, but it's taking me 10 minutes to do this note.
They're probably longer
So,
in some cases, right?
exactly.
Yeah.
So, you want to keep it as simple as possible. You want it to be thorough. But I mean, these providers are really most interested in being able to do their orders quickly, put in order sets, and then do their documentation in a very effective and quick manner. You can build in some of the coding behind the scenes,
Definitely.
but don't have too many required fields. There's different ways. Some like to point and click, accept this, deny that, but I find most of them just like to go into the dictation screen and either use drag in or quick text or something like that to get in there quickly and have some templates.
Yeah, and I would say though, as kind of this documentation progresses, or as healthcare progresses, that's probably going away more and more when we try to get specific, discrete data to kind of report towards. But there's still a lot of that out there. I just think that's the way the industry is moving, right?
Yeah, but sometimes.
But it's hard to get the providers to accept that, right?
Yeah, no, it's
definitely.
very hard to get them to accept it, and a lot of these providers are very efficient. Particularly ones that will have their own specialty office, and they may go into a hospital.
Yep.
You're there to see a patient. I worked with a podiatrist recently. He saw 40 patients a day.
Wow.
And he basically told me, he didn't seem like a very quick guy on the computer, but he's like, I've gotten this down to a science where I have a method. I have the kit that's prepared every day, so when I go in the room, it's only going to take me 5 or 10 minutes because everyone else is doing the prep behind the scenes. So you want to design a system where they're not spending the entire time in the computer doing their documentation. They actually need to communicate with patients. They've done studies about this, and they say that You know, when a system is built out too much, you know, the patient that gets the most care is the actual patient in the computer system. Because they make the chart look wonderful, they put in the orders wonderful, but then the patient hasn't actually seen the doctor. So you want to make
horrible.
sure they're not just treating the computer system patient, but they're treating the real patient.
That's a good point. That's a good point. I really appreciate you coming on today.
Hey, it's my pleasure. Thanks
my
for having
pleasure.
me.
So, as always, I just want to remind you to be kind, be careful, and always choose joy. We'll see you next time.
Yeah.
Thanks.